branch, that is the temporal branch, it supplies the extraocular muscles. Extraocular muscles. Here we can see some muscles. There are the muscles that supply here. Here we can see the muscles of the face. These muscles express our facial expression, and these muscles are supplied by the branches of facial nerves. Here is the frontalis. Here is the frontalis. It elevates our forehead. The contraction of this frontalis causes the wrinkle in our forehead. And here is the muscle that supplies that uh, encircles our eye opening, that is named as orbicularis oculi, and some muscle encircle our mouth opening, that is known as the orbicularis oris. So the branch of the facial nerve that comes here, two branches. One is the temporal branch, and another is the zygomatic branch. These two branches supplies the muscles around the eye. These two muscles supplies these two branches, temporal branch and the zygomatic branch supplies the muscles around the eye. And when there is the palsy of these branches, then it may cause the problem in eye closing. Problem in eye closing. Eye remains open by these muscles. Frontalis causes the wrinkling of the forehead, and the auricularis oculi is the muscle to close our eye. When there is the palsy of this nerve or this muscle, then there is difficulties in eye closure. And when uh, there is palsy of the nerve that supplies the mouth, especially the buccal branch, it supplies the orbicularis oris, and the marginal mandibular, it supplies the muscles that depresses the angle of the mouth and the lower lip. That means it innervates the depressor labii inferioris, and the depressor angulioris, this angle and this lower lip. So when there is the palsy of this marginal mandibular nerve, that means mandibular branch of the facial nerve, then there is the there is the difficulties in maintenance of the angle of the mouth. So and cervical branch supplies the platysma. Platysma is not directly related with our facial expression. It is related with our tone in the in the skin in the neck. So there are some branches of the facial nerve that supplies this part of the face. During examination of the uh, facial nerve, we have to examine these parts of the face. So when there is a injury of the facial nerve, then we have to classify this injury according to the grade, how much it is affected. First of all, sometimes we ask you the question, facial nerve palsy, about the facial nerve palsy, and we want to ask you whether this palsy is upper motor type of the lesion or the lower motor type of the lesion. For this reason, we want to ask you, do you understand? Do you understand what is the upper motor neuron and lower motor neuron? Rule number 33. Okay, rule number 30. Please answer my question. Please type it here. Please type your answer. What do you mean by upper motor and okay, upper motor, upper motor and lower motor? Lower motor. Roll number 33. Roll number 33. Please answer it. What do you mean by upper motor and lower motor? Here is the facial nerve. the nucleus of the facial nerve. It starts from here and leaves this brain stem and enters in the internal acoustic meatus. There is a picture that you will see now. Here is the here is total course of the facial nerve. Here you can see pyramidal cell and its processes. Mostly likely axon up to the cranial nerve nuclei is called the upper motor neuron. Okay, you are trying to make the answer that what is upper motor neuron, but okay, I will have no figure here to describe it, but remember it that upper means the upper, nothing above it. So, what is the structure of human body that lies above? It lies the cranium. In the cranium, in the upper part, what lies in here? Here lies the cortex of the cerebrum. Here is the cerebral cortex. So, the motor neuron that lies in this cortex, they are the upper motors. The neuron that lies down this, it might be the brain stem or the spinal cord in the anterior horn cell. The motor neuron that lies below the upper part, that is the lower motor. Upper motor is the motor neuron that has the cell bodies in the cerebral cortex, and the all other motor neuron nucleus. Nucleus means the cell body. Here we can see. So, for example, here we can see that here are the neurons. Here are the nucleuses of the facial nerve. So these nucleus are upper motor or lower motor. Question goes to roll number 15. Is there present 15? Number 15. Please answer. Write your answer 15. Whether these neurons or the nucleus we see here in this picture is upper motor or lower motor. Roll number 15. Absent. 15 is absent or present? I think absent. We could not write here. Okay. 46. Anu Orunima. Purna Onurima. 46. Please make the answer. Present, but he's not responding. 46. Orunima. Please just give your answer whether these motor neurons are upper motor or lower motor. No, Mohammed, you are 15. Mohamedul Islam. Are you roll number 15 or 46? I have asked the question specifically to roll number 15 and he is not responding. Then I switch this question to the Mohammed is 15. Okay, these are the lower motor. Mohammed told us that these are the lower motor. Why this is lower motor? As because they are not the cerebral cortical cells. Above this is the brain stem. Above this, there are the here is the one hemisphere and here is another hemisphere. The cell body that lies in this part of the brain, the cerebral cortex, they control this motor neuron. They are the upper motor neuron. So the cerebral cortical neurons are the upper motor, and in this cranial nerve, the nucleuses are remain this bulbar area. So these are the bulbar nucleuses, and these are the lower motor nucleuses, and the motor nerves that supplies the limb or leg or our hand or uh, their motor neurons are located on the anterior horn cell. So the anterior horn cell are the lower motor neuron in case of the limbs, and in case of the face and the neck, the lower motor neurons lies in the brain stem. So these are the lower motor neuron. So in the limb, we have easy way to determine whether it is upper motor or lower motor neuron deposition. Uh, we can make a uh, we can make a, uh, we can make a stimulus to our foot if the, 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 the dorsiflexion or the plantar flexion in the toe, then we can make it that it is the whether upper motor or the lower motor lesion. That is the way of defining the lower limb lower limb lesions. But when there is the facial lesion, how can we make it that it is upper motor or the lower motor? It is very easy, very easy. Today I will describe you that the nerve, the nerve that supplies this area, this forehead area, that means the temporal branch of the facial nerve, it gets bilateral innervation. That means the motor neuron that supplies the temporal area, the frontal area, so that temporal nerve, it receives bilateral innervation from the cortex. That means it receives the upper motor neurons from this part and the upper motor neurons from this part. This bilateral control remains here. So if there is any lesion in this part, so for example, this is the left side, this is the left side, and there is the lesion in the left upper motor. That means cortical neurons of the facial nerve. It will produce some form of the lesion in this side, this left side. So if there is an upper motor neuron type of the lesion, that will produce some form of the paralysis in the left side. And if there is lower motor type of the lesion in this left side, it will also produce some form of lesions in this left side. So how can we differentiate this thing? If there is lesion in this upper motor neuron, then there is paralysis in this left side, and if there is lower motor type of the lesion, there is also paralysis in the left side. And now difference is that when there is the lower motor type of the lesion, there is upper motor type of the lesion and lower motor type of the lesion, we can see that this nucleus receives the signal from the contralateral side also for this muscle. For this muscle, that means this temporal branch of the facial nerve. So now I want to ask you the question that when there is a there is a lesion. I'm not sure whether it is upper motor or the lower motor. There is a lesion, and I see that uh, for two people. I would give two examples of two people. One people has the facial nerve palsy. I see that there is the palsy, that the eye is opening, mouth is drooping, and the face is deviated toward the normal side. This is the lesion. One side this lesion, and one people has, he can make this wrinkle in the forehead, and another people who has also the facial palsy, but he cannot wrinkle this forehead. So my question goes to roll number 20. Roll number 20. Do you present here? If there, please write yes. Roll number 20. Then I will ask roll number 19. 20, then 19. Two same question to the two people. My question is that one person with facial nerve palsy has the uh, forehead like me. He can wrinkle his forehead like this, bilateral wrinkle. And one person has facial nerve palsy, but he cannot elevate this part, and so that there is no wrinkle in the forehead. So my question is, which person has which type of paralysis? One person has wrinkle in the forehead with facial palsy, and another person has no wrinkle in the forehead but also facial palsy. So which person has this type of paralysis? Roll number 20 and roll number 19. Please write on your answer in here. Who has wrinkle, upper motor or lower motor? Write down like this: wrinkle, upper motor, no wrinkle, lower motor, or wrinkle, lower motor, no wrinkle, upper motor. Just write it here. Are you absent here? 19, 20? Are you absent here? I'm asking you. You are not responding. NIPA. Here, your NIPA is 19. So, what is no? NIPA is 19. Tasnim, facial apex with wrinkle, upper motor neuron. Okay. It is roll number 20. She gave me answer and I will discuss with this. Just a second. Roll number 20. Okay. Roll number 20 gave me the answer, but roll number 19 did not give the answer. So what is your answer, roll number 19? I'm making you that roll number 20 has the answer that the guy who has wrinkle in the forehead has the upper motor type of the lesion. But roll number 19 is not still answering the question. The upper motor type of the lesion has wrinkle in the forehead. Why? Why? Let you explain you that upper motor type, but 19 is not answering the question. Why? You cannot you hear me? Here is the nerve. One nerve we see, and and uh, without wrinkle, lower motor type. Why are you tired? Just LMN. This is the lower motor. Why are you typing more words and wasting your time? Just without wrinkle, lower motor, with wrinkle, upper motor. So both of you make the same answer that if there is the lower motor neuron lesion, there is no wrinkle, and if there is upper motor neuron, there is wrinkle. I think you are clear about the explanation. Though you clear, I want to make sure that what you have clear. This is the lower motor. This nerve is the lower motor. This nerve conveys the lower motor fiber, and the upper motor fiber is above here. Upper motor fiber is above here. So when there is the upper motor lesion, the opposite side can control it so that there is wrinkling present in the both sides. When there is the lower motor type of the lesion, here the lower motor is blocked. So if any signal comes from the upside, it cannot transmit through this. If there is the injury in here and injury in here, and upper motor is okay, so signal from this side and signal from the opposite side also comes here, and but issues that this signal cannot generate any signal in the lower part as because there is the lesion in the lower part. So I think you are clear that when there is no wrinkle, that is the lower motor type of the lesion, and when there is the wrinkle in the forehead, that is the upper motor type of the lesion. I think it is clear to you, so I will not continue it. This is the upper motor type of the lower motor type of the lesion. But in our case, we are always deal with for the disease of the ear. We are mainly deal with the lower motor type of the lesion. Here you can see the facial nerve, course of the facial nerve. I think you have to draw and level this thing in your homework as your homework. The course of the facial nerve. Here you can see this. This is the intracranial cranial part of the facial nerve. From the frontomedullary junction, the facial nerve comes out, and here is the interacoustic meatus, and through the internal auditory canal. through the interauditory canal, the facial nerve moves laterally and forward. And here is it comes at the comes here to form a ganglion, and this is a curve. This curve is forming like the elbow, or there is a genu in here. For this region, this is known as the first genu of facial nerve. There is a ganglion present in this genu. This ganglion is known as the geniculate ganglion. So first thing, the intracranial part of the facial nerve. Then it is the labyrinthine part of the facial nerve. It is the this is the meatal, interauditory meatal. This is the meatal part, and after leaving the internal auditory meatus, interauditory canal, they form the labyrinthine part of the facial nerve. This labyrinthine part has a genu. From this genu, this is the first genu. Here is the second genu. It passes behind, and here we see that there is the round window. Here is the oval window. In uh, below the oval window, this facial nerve passes horizontally backward, and this is the tympanic segment of the facial nerve. After reaching this nestoid process, this facial nerve goes downward and forming the mastoid segment of the facial nerve. So this facial nerve here, when the facial nerve passes from the second genu to the stylomastoid foramen, this is the vertical part of the facial nerve, and where the facial nerve present in the middle layer, they are known as this is known as the tympanic segment of facial nerve. Tympanic segment of the facial nerve. I have done a little mistake. Here is the oval window, here is the round window, here is the oval window. Above the oval window, above the facial nerve comes behind, above the oval window of the middle layer. Here is the round window, and this is the facial nerve. This is the course of the facial nerve. You can draw and level this course of the facial nerve. Sometimes it comes in your written exam to write down the course of the facial nerve. Now, facial nerve can be injured in this if one person has hemorrhage or ischemic stroke. They may have some form of the paralysis of the facial nerve, and sometimes during the ear surgery, there might be some injury in this part. During the ear surgery, we do the stepidotomy or stapedectomy. That means stapes surgery. Here it is removed and prosthesis insert. Have to insert here. The facial nerve is very close to here. During this surgery, the facial nerve can be injured. And the middle ear surgery, especially the mastoid surgery, we have to drill out all the mastoid process. So during the drilling of the mastoid air cell system, the facial nerve can be injured. That will cause the lower motor type of the facial nerve palsy. So when there is the facial nerve palsy, we have to make the grade of this facial nerve injury. There are different grading system in the literature, and the widely accepted grading system of the House-Brackmann facial nerve grading system. The House is very prominent otologist, and Brackmann is also another otologist. They proposed this grading system in the 1985, and they made the facial nerve weakness or facial nerve palsy. Mostly this palsy are the lower motor type of the palsy. This palsy into different grades like normal, slight dysfunction, moderate dysfunction, and moderate dysfunction, moderately severe dysfunction, and total dysfunction. So they use this classification in different. It has different components like growth, at rest, and motion. You can read it, you can go through it. The grade 1 injury is the normal. When facial nerve function is normal, it is grade 1. When there is complete paralysis of the facial nerve of one side, that is the grade 6. And other grades are in between. Slight dysfunction, that means if you see the person very closely, if you observe the person very closely, you can understand that there is a palsy. Here we can see the different pictures of facial nerve in different grades. In the grade 1, we can see that there is the normal face. In the grade 2, we can see. Can you see any change in the grade 2? Can anyone see any? I can zoom it a little bit. No, it will not be more zoom. Can you see any differences between grade 1 and grade 2? Can you? Anyone can see any differences? If yes, then write just Y so that I can understand. We have, and if you cannot understand, then just N. Do you understand? Is there any change in grade 1 and grade 2? Okay, no answer. No one is answering me. No one can understand this thing. Okay. Okay, it is very difficult to understand whether any differences between grade 1 and grade 2. But grade 6 is very clear cut. We can see that this angle of the mouth is deviated toward this. The eye is very asymmetric, and forehead is also asymmetric. In this figure, the facial pulse in this side. In this side, there is the facial pulse. In this rest, this is the picture at rest, and this is the picture at motion. Here we can see that her mouth is deviated more toward this, and she cannot close her eyes. She cannot close it. Her asymmetry of her eye remain in this part. So you can today my topic of discussion is the facial nerve. What are the roots of the facial nerve? What is the course of facial nerve? And how facial nerve get injured in different situations, like a stroke and surgery. And another injury of the facial nerve is the parotid surgery. During parotid surgery, we may injure the peripheral branches of the facial nerve. So up to this, we have understand the anatomy of the facial nerve, course of facial nerve, and finally the injury of the facial nerve. There are different grades of the facial nerve. House-Brackmann staging system is one of them, and we are discussing about the House-Brackmann staging of facial nerve pulse. My homework to you, first thing is the draw and label the course of the facial nerve, number 1. Number 2, write it down and memorize the different grades of the facial nerve injury in the House-Brackmann staging system. For you, I can make it just for make it easy. I want to describe the grade 4. Here is the grade 4. So how can we memorize this grade 4? Grade 4 has 3 components, that is gross and at rest and motor. Motor has also 3 components: forehead. Forehead, motion in the forehead. There is no motion in the forehead in grade 4. But in grade 3, there is a slight to moderate motion. So when there is no movement in the forehead, grade 4 is a start. And there is incomplete eye closure in the grade 4. And here, grade 3, you can see that there is complete eye closure with minimal, with maximum effort. In grade 3, eye can be closed with effort, but in grade 4, there is no closure of the eye. So first thing, forehead, there is no movement, there is incomplete closure of eye, and finally the mouth, angle of mouth, the asymmetry with maximum effort. There is asymmetry during the motion. At rest, normal symmetry and the two. In the grade 4, there is normal symmetry and tone in when patient is at rest. When she tried to move her mouth or forehead or the eye, nothing can do completely with grade 4 lesion. So you can memorize this thing like this. So I am trying to finish my lecture right now. Do you have any question? Only 3 persons with us. Do you have any question? If you have no question, I will finish this lecture. And if you have any question, then you can ask me later on the comment section or in the WhatsApp. So thank you all. Thank you very much for attending this. There are 29. I request the CR to make the um, percentage one online. Okay, thank you.